Hello, everyone. Good morning, and welcome to the National Hispanic Council on Aging webinar, Taking Care of Yourself While Caring for Others. My name is Christine Perez, NHCOA's Director of Programs, and it's my pleasure to moderate today's virtual event. So, this webinar will focus on the importance of self care for family members who take on the role of caregiver for their loved ones. It will feature expert insights about caregiving among Latinos, osteoporosis among Latino caregivers, a caregiver's personal experience, guidance on practical tools, and resources that can help make caregiving more manageable and less overwhelming. We will also discuss the importance of addressing the digital divide among older adults and caregivers, a barrier that often keeps older adults and caregivers from such helpful resources. And this webinar is in partnership with the Administration for Community Living, also known as ACL. So, to begin this webinar, let's welcome our first speaker. And to start with the panel session as well. So, Latino caregivers play a vital role in supporting the health and well being of their families and communities. Rooted in strong cultural values and a deep sense of responsibility, many Latino caregivers provide essential care to loved ones while often balancing work and other commitments. But let's hear more about this topic from our first speaker, Pedro Lima, NACOA's Finance and Project Development Manager. Today, Pedro will provide an overview about Latino caregivers. Welcome, Pedro.
Gracias, Christine, and good morning, everyone. And thank you so much for taking the time to be here with us today. To ACL for making this possible, to the National Hispanic Council on Aging team for organizing it. It's truly an honor to be here today. I would like to begin by asking something simple. I know that being in a webinar, I won't be able to hear or see you, but please take a moment to reflect on this. Do you consider yourself a caregiver? Next slide, please. Because the reality is many people don't, even when are caring for someone every single day. And that's one of our biggest challenges we see, especially in the Latino community. Many people who are family caregivers simply don't identify themselves as caregivers. They see themselves as a daughter helping her mother, a husband supporting his wife, a neighbor checking in on someone. They see it as a love, as responsibility, as something you're supposed to do. And when that role goes unrecognized, that is where the gap starts. Because when you don't see yourself in that role, you are less likely to look for help, less likely to access resources, and less likely to receive the support that actually exists for you. Next slide, please. So let's begin with what is a family caregiver? Let's ground it in something simple. What do we mean by being a caregiver? A family caregiver is typically an unpaid individual who provides care and support to someone they know. It can be a parent, a spouse, a loved one, a friend, or even a neighbor. And that care can look like many things. Taking someone to medical appointments, for example, or managing medications, helping with daily routines, providing emotional support, or simply being present, but consistently. Sometimes it's a few hours a week, sometimes it's every single day. Next slide, please. So, according to ARP, there is over 53 million caregivers in the United States. That's about one in every five adults. Caregiving is not an exception. It's part of how our families function every day. But the reality is, next slide, please. Caregiving can be deeply meaningful. It can be an act of love, of gratitude, of respect, but that same care also comes with a cost. Many caregivers experience high levels of stress, emotional exhaustion, physical fatigue, financial strain. Caregivers often prioritize everyone else's well-being while putting their own health last. Next slide, please. If the caregiver breaks down, the entire system breaks down with them. So let's reframe this pressure. Next slide, please. This is not about adding more pressure. Caregiver already carry enough. So please understand that it is okay to ask for help. It is okay to take a break. It is okay to reschedule an appointment, for example. Caregiving is not about doing everything perfectly. It's about doing the best you can. Giving yourself grace is part of that. Next slide, please. This is why storytelling has become such an important part of our work at the National Hispanic Council on Aging, because data helps us understand the scale, but stories help us understand the reality. They allow us to see what caregiving actually looks like in people's daily lives, the decisions, the trade-offs, the emotional weight behind it. And through this work, we have had the opportunity to hear from many caregivers across the country. And I want to share one of these stories with you. We spoke with a caregiver named Amparo. She has been caring for her mother, who is in her 90s, while also working in multiple jobs. So when you asked what her biggest challenge was, no surprise, she didn't hesitate. She said, time. Time to balance work, to manage responsibilities, time to provide care. She shared that some days she has to make difficult decisions, either working more hours or being physically present for her mother. She also talked about the financial pressure, needing to continue working while covering caregiving expenses for her mother. At the same time, she shared something very honest, that she feels tired, that she feels overwhelmed sometimes, that much of the responsibility falls entirely on her. And yet she continues because for her, it's not just a responsibility, it's an act of love. And stories like Amparo's are not unique. They reflect the reality of millions of caregivers, especially in Latino communities. Next slide. And I would like to be more specific regarding Latino caregivers. And as we have seen exemplified, caregiving does not look like the same for everyone. And this is especially true for Latino communities. In fact, Latinos represent about 1 in every 5 caregivers in the United States, which means more than 11 million Latino caregivers nationwide. And what makes this even more important is not just how many, but how caregiving look in these communities. In Latino communities, caregiving is deeply connected to culture. It's rooted in values like family or familismo, as we say in Spanish, respect and responsibility. Caregiving it's not just common, it is expected in Latino families. Latino caregivers are more likely to provide high intense care and often 30 hours or more per week. They also are likely to live with the person they are caring for and to take more on hands responsibility. At the same time, many Latino caregivers are in lower income households, often earning below national average, while still covering caregiving expenses out of pocket. And many are part of multi-generational households, balancing caregiving work, and raising the children at the same time. So what we see is clear imbalance, more responsibility with fewer resources. And on top of that, many caregivers face additional barriers like language access or limited culturally appropriate services. So again, this care is being provided out of love, but love alone does not reduce stress, and it does not pay for medications, transportation, or time. Next slide, please. This is exactly why support systems are so important, because caregivers cannot do this alone. And at the National Hispanic Council on Aging, this is something we've been working for many years. We've developed a family caregivers trainings. We have all offer both in virtual or in-person settings. and in communities across the country. And we are actually preparing to release a new version of this training by this summer. These trainings are designated to help caregivers better understand the role, learn practical tools and strategies, and most importantly, understand the importance of taking care of themselves. Because again, if you're not taking care of yourself, it becomes much harder to continue taking care of someone else. So we always encourage caregivers to look for opportunities like this, whether through NACOA or other organizations where they can access support, education, and community. Because caregiving should not be something you have to navigate alone. Next slide, please. Now, after all I have said, I will ask once again, do you consider yourself a caregiver? The chances are you either are one, you have been one, or you will be one. The more we recognize the role, the better we can support those who carry it. Because caregivers take care of everyone. And today it's about making sure we take care of you. Thank you. And back to Christine.
Thank you, Pedro. I love the quote you mentioned at the end. And again, thank you for your presentation and useful information for all of us. So now I will continue with some welcoming remarks from Dr. Danita Cruz. She's the president and CEO of NACOA. She's one of the nation's foremost advocates and spokespersons for diverse older adults and has been recognized for her commitment and leadership on behalf of diverse older adults nationwide. Welcome, Dr. Cruz.
Good morning. Thank you. Thank you, Christine, for those beautiful words. And thank you, Pedro, for that wonderful presentation and an important reminder of what caregivers are going through. I'm delighted to welcome you and to welcome all the attendees to this webinar. I think we need to have more of these conversations where we reflect on the importance of not only aging, but also caregiving and what it takes for a caregiver to be able to provide this support. I remember when I had to support my own mother with caregiving. And as some of you know, my mother had to move into my house for a little bit at the end of her life. And so I was, doing a job, holding a full-time job while taking care of her. And it was a very challenging experience. Despite the fact that I'm in the field of aging and I know where the resources are, I understood the latest research, and yet it was very, very challenging. So I am so glad that we're, pausing for a minute to have this conversation and hopefully, help each other with some ideas on this matter. And we do know that an older adult in need of support from a caregiver will often receive this support from family members. And these are not professionals, they are not paid. They are loved ones who feel no other choice but to support their loved ones, their elders, and or someone with a disability, which it could be the case as well. They perform this function simply as an act of kindness, out of respect for giving back to those who gave so much when we were younger. Um, or perhaps this older adult was their parent, their grandparent, and they now return the care they receive in childhood. In any case, family caregivers are individuals who have essentially taken on a second job in the name of providing quality care for their loved one. And while this commitment is based on love and based on dedication, it can also bring emotional, physical, and financial challenges. And that is why today's topic is so important. Taking care of yourself is not a luxury. It's essential to both the caregiver's mental health and to the well being of those they care for. When caregivers make it a priority to take care of themselves, they are better able to provide and sustain the care that they're providing for their loved ones. Over the years, we have made progress in recognizing the essential role of caregivers in providing the health and well being of older adults or persons with disabilities. Today, there are more resources available, and awareness on the issue is thankfully growing. In areas such as Alzheimer's and dementia care, for example, we have seen significant advances in research, which has likewise served to raise public awareness of the challenges families face and who are coping with these situations. But demand continues to exceed available support, and too many families are still managing these challenges without the necessary information, respite, and guidance. So we need to continue to advocate, we need to continue to raise awareness, and we need to continue to remain informed and active. And I know this both professionally and personally. There are many within the Latino community who unexpectedly, from one day to the other, take on this role without training or preparation, but simply out of loyalty and necessity. That experience can be overwhelming. This is why we need stronger systems, we need stronger policies, and community support for caregivers. We also need to continue humanizing the caregiving experience. People often only see the illness or the limitations that define the caregiving dynamic and forget the full humanity of the person receiving the care, as well as the person supporting with the care. They are, as we know, individuals with histories, with talents, with many contributions to this world and dignity. Caregivers deserve to be seen as whole people whose well being matters. And as a country, as a society, we often choose to admire people as caregivers for their strength and their capability, y si se puede. But that admiration often becomes a label and an assumption that their capability means they don't require any support, any respite. They may be strong, but they do need help and they do need support. I know it personally when I was there. Um, and and when caregivers are supported, we also know that the people they are supporting and they're caring for are also supported. At the National Hispanic Council on Aging, we are committed to educating, raising awareness, advocating on Capitol Hill and at the state level, and sharing culturally and linguistically competent, relevant resources to better support our community, particularly caregivers. And conversations like this, webinars like this, are one important part of our ongoing efforts to ensure you have the knowledge and the tools you need. So I thank you for taking time for this important conversation, for for the sake of your loved ones and the love of your community and your families. And my hope is that today's discussion leaves you empowered, encouraged, and informed to better connect on caregiving issues. And please follow us on our social media channels for more information, for upcoming webinars, and for action that needs to be taken as we do our work. So thank you and continue to enjoy the webinar.
Thank you, Dr. Cruz, for your remarks. So please be sure to hold on to any questions you have during today's discussion and remember to type them into the chat box. At the end of the panel session, we will have a question and answer session where we will have the time to review all the questions that have been posted in the chat. So before we move on to the next speaker, we would like to invite everyone to participate in a quick poll. And the question is, in your opinion, what are the benefits of supporting caregivers? So I'm going to add the poll right now so you can take a look at. You have some options. For example, it helps reduce overall healthcare costs, strengthens a vital workforce for those caring for older adults. It helps keep caregivers healthy. And if you would like to share other benefits of supporting caregivers, we invite you to type it into the chat box. We will be giving you like a few seconds, 30 seconds, to submit your responses. As of now, I can see that some of the benefits of supporting caregivers is it helps the caregivers, be healthy. Then followed by it helps reduce overall healthcare costs and strengthens a vital workforce caring for older adults. Thank you again for participating. I think I will be sharing the poll so you can take a look at it. And I'll close in the poll. So thank you again for participating in the poll. And as we continue with today's presentations, caregiving resources and the toolkits are essential in helping caregivers navigate the many responsibilities that come when taking care of a loved one. These tools provide practical information, guidance, and strategies to manage daily tasks, access services, and make informed decisions about care. So let's introduce our next speaker, Ocean Lee, Programs and Communications Manager at the Diverse Elders Coalition, also known as the DEC. Today, Ocean will highlight the DEC's caregiving resources and also their toolkit. Welcome, Ocean.
So thank you for having me today for this webinar to discuss the importance of caregiver well-being. Before we dive into the Diverse Elders Coalition's research, just wanted to provide some background information that's vital in the work that we're able to do with diverse family caregivers. So the DEC was founded back in 2010 to ensure that the unique needs and perspectives of diverse older adults would be heard when and where it mattered. The coalition is made up of 6 member organizations who represent racially and ethnically diverse people, American Indian and Alaskan Natives, and LGBTQ plus people. As a coalition, we engage older adults on the issues that impact their lives, which also includes family caregivers, and together we advocate for policies and programs that center diverse older adults and caregivers and improving aging in our communities. Next slide, please. So this is just a visual representation of our 6 member organizations who are the heart of the work that the coalition does. Together, these 6 member organizations, we represent 8 different diverse group of caregivers. These organizations represent 93 plus affiliate members across the nation and millions of diverse older adults across the nation. There are national leaders. You're being hosted by one today, the National Hispanic Council on Aging, with innovative and culturally affirming practices that lay the groundwork for any research that comes out of the DEC. And just as a note on research, it wasn't always that way at the Diverse Elders Coalition. Back in 2019, we realized that the health and well-being of older adults depended on the health and well-being of the ones caring for them. And so we made a shift from advocacy to research to better learn about diverse family caregivers. Next slide, please. And with that switch, that brings us to the Caregiving Initiative. At the end of 2018, we received a research grant from the John A. Hartford Foundation called the Caregiving Initiative to analyze existing research, generate original research, and develop policy and programmatic solutions to meet the needs of diverse family caregivers, which is still ongoing today. But rewinding back to 2019, we held 18 stakeholder interviews with providers across the nation to learn more about working with caregivers and what that means. We translated a national caregiving survey into 8 different languages and held more than 1,000 respondents across the 6 different diverse groups represented by the DEC. And we also held 36 in-language focus groups across the country with diverse family caregivers to learn more about their needs and to fill in the gaps where quantitative data couldn't. All of this work informed the development of the DEC's Caring for Those Who Care curriculum, which is for providers, and our toolkit that Christine mentioned earlier. But yeah, this research is still ongoing today. During the pandemic, we held listening sessions to update the curriculum, and most recently, we conducted a literature review in 2025 to ensure that our original findings were still relevant today and to be inclusive of other groups, such as LGBTQ plus people of color and direct care workers. Additionally, last year, as I mentioned, we did a literature review. We were able to confirm our original findings and compile all of this information into the DEC's caregiving policy best practices toolkit that I'll share later in my presentation. Next slide, please. So before we talk about solution and what helps, I want to ground us in the DEC's research, which has shown very clearly caregiver well-being is a part of healthy aging. When we talk about supporting older adults, we also have to talk about what caregiving is doing to the people providing that care. This is exactly the kind of self-care, stress management, and emotional well-being focus that the National Hispanic Council on Aging is centering in today's webinar. Going back to our research in 2019, we found that 43.1% of respondents, survey respondents, said that they were the only person helping the care recipient. 26.1%, or 1 in 4, said they felt more isolated because of caregiving. And 23.3% reported more health strain, which includes both physical and mental health strain. Because of that, 14% reported depression symptoms, sometimes or more, in the last 6 months of caregiving. We also found that half of respondents use one or fewer formal supportive services, which tells us that many caregivers are carrying a great deal of burden with limited help, exacerbating that mental health strain, today's topic of the webinar. So when this slide says caregiving affects mental and physical health, increases isolation, and often happens with little and fragmented supports, this is not just a general statement. This is what caregivers are telling us directly from 2019 to today, 2026. So it reminds us that self-care is not separate from caregiving. It's essential. It's a part of what makes caregiving sustainable, and we need to do a better job of it. Next slide, please. And so when we look more closely at Latino caregivers and Hispanic, Latino, I'm just gonna say Latino caregivers just for the ease of things, because I usually say both Hispanic, Latinx, but I'll just say Latino caregivers. But yeah, we see that these pressures or these issues are often shaped by culture and language, and how it can exacerbate many of the statistics we just went through regarding care and isolation. When we focus specifically on Latino caregivers, one of the clearest themes is that caregiving is often deeply rooted in familyism, what Pedro mentioned earlier, and family responsibility. Familyism is a cultural value where the family unit takes precedent over individual interests. And so, with that being said, caregiving is often seen as something that simply needs to be done rather than a role. And Pedro also talked about the lack of caregiver self identification. So yeah, our research also notes that 27% of Latino individuals in the U.S. live in multi-general households, which helps explain why caregiving is so woven into everyday life, and they don't see themselves in this role that's covered by formal services. But these strong family commitments does not mean caregivers are well supported. In our 2019 survey, more than half, or 51% of Latino caregivers said they were the only person helping the care recipient. 30% or one in three reported more isolation. 31.3 reported more health strain, which includes again both physical and mental health, and 16.3% reported more depression symptoms in the last 6 months. So as you can tell from the statistics from the that you saw earlier from the general caregiving population that we survey, a big proportion of those numbers come from Latino caregivers. Lastly, more than 1 in 5 Latino caregivers reported having no family, friends, or neighbor helping or supporting them, resulting in themselves carrying the burden of care, which exacerbates many of the health issues that we cover in this webinar. But beyond that, language and system barriers also matter a great deal, which we will discuss further in the next slide if there's time. But Spanish speaking caregivers feel less prepared for the role, which can also lead to isolation as they're unlikely to seek formal help. 73% of US Latino households speak Spanish at home, making it more difficult to receive formal care and worsening health outcomes. And in our most recent literature review, this was reinforced. Lower acculturation rates, which was basically like assimilation, was linked to higher distress among Latino caregivers. And so for Latino caregivers or Hispanic Latino caregivers, the story is really one of both strength and strain. Stronger family commitment, but often too little support. Deep cultural grounding, but systems are not always easy to navigate, especially when you take in language and culture in consideration. Next slide, please. And we'll just, next slide, this is if we have time, but I'll just go to the next one again. Yeah. So I just want to jump in this to talk about what helps. The encouraging part of the DEC's research is that it does not just identify issues, it also points us towards what helps. So yeah, just going to go through the list here. First, trusted, culturally grounded support matters. Our 2025 literature review found that community health worker models improve dementia support and service access for Latino communities. This points to the power of trusted messengers and community-based supports in supporting Latino caregivers. Second, in-language information and interpretation matters tremendously. The DEC toolkit recommends using trained medical interpreters, to help people ask questions, navigate services, etc. Third, mental health support and caregiver connection matters. The 2025 literature review confirmed that inclusive mental health and person-centered care models improved outcomes for Latino caregivers. And that's important because caregiving stress and burnout, when caregivers feel like they're doing everything alone, can exacerbate and worsen if there's not those sort of supports for them. And just kind of skipping to the last one, finally, the idea of meeting the community where they're at is really central and important. Families are more likely and caregivers are more likely to engage with supports when it's culturally responsive, meaning it's language accessible and delivered through trusted community members rather than expecting caregivers to navigate fragmented supports and systems that are not built for them. And so that I'll just finish up and pass it back to Christine.
Thank you, Ocean, for this great information and also for sharing the diverse elders coalitions caregiving resources and toolkit available for them. And also, I know just to summarize about caregivers that they are supporting their loved ones, whether family member, spouse, older adult, or someone with a disability. And while the role can be demanding, as previous panelists have mentioned before, we know that access to caregiving resources and tools, just as what you just mentioned, Ocean, can help ease that burden and also provide essential support. So once
Definitely.
again, thank you, Ocean. And once again, please feel free to write your questions in the chat box into your question and answer session. We have that part at the end of all the panelists' presentations. So far, we have heard about Latino caregivers and the resources available to help and support caregivers in their role. So now let's hear directly from someone with firsthand experience. We are quite thankful to have a testimony which offers a personal and powerful perspective on the realities of caregiving. And sharing lived experiences is important because it helps us better understand the reality, uh, challenges, strengths, and the resilience of caregivers in their own words. So let's welcome Margarita Navas. She's from NHCOA's Office Manager and International Affairs Advisor, who will share her story as a caregiver. Welcome, Margarita.
Thank you, Christine, and thank you for this space to share my story, my experience for caring my mother. And I'm going to give a little bit of her character. And this time, she was diagnosed with Alzheimer's years ago, and she passed away in 2013. But my mother was a strong, loving, sorry, an independent woman. She was the one who made most of the decisions in our family, and which many times she was the leader of our home, especially because she was also her own boss. She was an entrepreneur, self sufficient, and very creative, always thinking of new ideas and ways to start a new business, especially when she moved to this country. She had five kids, four boys and me, and three of my older brothers and myself. We pursued our studies and became professionals in different fields. My youngest brother he had Down syndrome, so he went to a special education school for a few years. Back then, special education was not that developed in my country, El Salvador. Um, but my mother, despite all these responsibilities, she raised us with dedication, gave special attention to my younger brother, and managed her business at the same time. Um, she had these many goals when she moved to the US, and one of her biggest goals was a dream. It was to open her own business. She had everything ready and lined up to start his new business. But at the last minute, she decided not to move on because we still were in El Salvador, and she was all by herself here, and decided to go another route. And she worked for DC public schools as a uh, um, assistant teacher, and she was the one who spoke Spanish with the kids. And I want to give a very interesting story to show the character that she had. During that time, her class with another one were invited to the White House for an event. with their students. And it was during President Ronald Reagan, and my mom was love him, but he likes his everything about him, I guess. But in that group of invitees, it was Frank Sinatra, one of her favorite singers as well. So he gave her an autograph. She saved it and cared for it. When she had to send us some documents back home, she sent it to us. During that time, because of the war in El Salvador, the postal service was not too reliable, so the package never arrived to our home, to our house. And my mother, until she was very ill with Alzheimer's, she always mentioned that story because the one that she was very sad is the autograph from Frank Sinatra. So I don't blame her. Maybe it will cost a lot of money nowadays. This is just a joke. But that was my mother. That was the person that shows her strength, sacrifice, and dedication for her family. And she has been my inspiration. She taught me this strength, to be strong and responsible, and I'm proud of her. And that strength and responsibility that I learned from her is part of what helped me uh, to become her own caregiver. And like Pedro mentioned before, as a caregivers, we think that we are not. Many people say, I thought I'm just the daughter who's taking care of my mom that I love so much. And I didn't realize that a part of that, I also had my own responsibilities as a housewife, mother, teacher, and because I teach English as a second language, and I was teaching adults during that time. But I said no, and she's coming home with me, and I'm going to take care of her, despite all the responsibilities that we have. Facing that moment that she was diagnosed with Alzheimer's was very difficult because during that time, um, the tests were only in English in the DMV area. There were not many in Spanish, and no one in this area during that time, according to the doctor that I took her, said, no, there's no one here that he can provide the test for your mother. As always, I say I'm going to be the interpreter, but he said no. So I understood that. But the family, my brothers and myself, we were in denial of accepting that she had Alzheimer's, especially after all this, the character that she had, the way she was all her life. So we didn't want to accept that, but we didn't have another choice because we didn't. There were not anyone here to provide her a test. So I said, okay, fine. I became her caregiver. The challenges that when I became my mother's caregiver, when I moved her, especially to my house, I didn't realize how difficult it was going to be because she was in bed 24/7. So, and I didn't have any experience as a nurse or caretaker. And it was one day to the other, I became her caregiver. The stress of being, but I did it because I loved her. Like many caregivers, we do the same thing, and we have been mentioned this in this webinar. But the stress of having so many responsibilities the lack of sleep, the didn't take care of myself, felt somehow isolated of because my kids were growing up. They had their extracurriculum activities, and thank God we have family that they help with that. But time was passing by, and sometimes people with Alzheimer's they can last long. Not because I'm saying that we were waiting, but it's a long um, illness sometimes. She was in bed for 10 years. So, and during that time, also the resources were not as they are now. Um, I called places, they put me on hold, so I didn't insist. And those are the things that were then. Now, I think we have new, it has changed. It has changed many things, and policies has changed help and connections and contacts is faster. There are more professionals trained to care for older adults with Alzheimer's, and there is the community is there's more awareness of for Alzheimer's, which back then even for families it was kind of a taboo or embarrassment because we connected like this mental illness and is so it has changed, but we still need more studies. We are almost, I think, close to maybe find a cure, but no, is there is not enough. Of course, this means that we cannot stop. We need more funding for research, education, and along with education, helping caregivers. One of the things that takes me or recommendations is that caregivers they need to ask for help, family members, friends, neighbors. Many times people want to help, people want to help, but they don't know how, or they don't know if it's well taken, their contribute their help. So it's important to tell someone at church, a friend or neighbor, I need some help. The other one, and this is important because that's the way I felt, is don't feel guilty if you take care a break. You take a break of your responsibilities, and not only as a caregiver, but also as with your family. But you need to take some time to relax to yourself, to charge your batteries because it's it's a lot of work. it's And the last one is there are many resources. Do a research. Don't give up in that. Insist if you don't find something, continue because nowadays is there are more resources, but like I said, not enough because many families still, especially in our communities, they are caregivers and they don't have access or knowledge. So it's important to educate them and help them. And what I tell them is go to our organizations like NHCOA or Alzheimer's Association or ARP or NIH. But it's also inspiring as a caregiver because this is I want to close with this. My daughter just graduated from nursing, and I asked her, why did you choose that? Because I never, when she was little, I chose something else. And she said, because I saw the way you took care of my grandma. So let's not forget that part too, that we are serve as inspiration. Thank you for listening, and Christine.
Thank you, Margarita. Margarita, if you can mute yourself a little bit so there's no echo. Thank you so much. Thank you again for sharing this powerful testimony and also reminding us that it's imperative to make resources, right, and support accessible for example, by meeting people where they are. Thank you once again. Gracias. So, our next topic is about bone health, particularly about osteoporosis. Osteoporosis is a condition that weakens bone health, the bones, and increases the risk of fractures, particularly among older adults. In Latino communities, it is often underdiagnosed due to barriers that worsen healthcare access, lack of awareness, among others. So, caregivers play a key role in supporting bone health through medication management, nutrition, fall prevention, among many others. But let's hear more from this topic with our next panelist, Cristina Pacheco. She's NHCOA's Director of Policy and Resource Development. Today, Christina will be highlighting and providing an overview about osteoporosis among Latino older adults and caregivers. Welcome, Christina.
Thank you, Christine. And good morning, and thank you for the opportunity to speak with you. Today, I'll be talking about osteoporosis through the lens of caregiving. Can you please start my slides? And this is important because osteoporosis doesn't just affect individuals, it affects families, and caregivers are often the ones holding everything together. Next slide. So as Christine shared, osteoporosis is often called a silent disease because people don't feel it developing. Over time, bones lose strength and density. And you can see this in the image, and many people don't even realize it until they have a fracture, sometimes from something as simple as a fall or a repetitive movement. These fractures are not minor. A hip or a spinal fracture can lead to hospitalization, surgery, and a long recovery. And in many cases, individuals may not return to the previous level of independence that they once enjoyed. Osteoporosis most commonly affects adults over 50, especially women post-menopause, but it also does affect men. As we age and our hormones change, bone density naturally declines. Without enough calcium, vitamin D, and physical activity, bones become weaker over time. And once fractures occur, the impact can be significant. It can affect mobility and independence and often leads to the need for caregiving support. Next slide. So why does this matter? About 14.7, back the other way. Thank you. About 14.7% of Hispanic adults aged 50 and older are affected by osteoporosis, and rates are rising fastest among Latinas. But this is only part of the picture. Many more individuals have low bone mass, meaning they are already at high risk for fractures, even if they haven't been diagnosed with osteoporosis. And this risk is not evenly distributed. Some Latino subgroups, for instance, Puerto Ricans and Mexican Americans, may experience even higher rates of serious outcomes like hip fractures. What's important to understand is that osteoporosis isn't just about bone density. It's about what happens after a fracture or a break. It can lead to a major shift in daily life, again, with that loss of mobility and loss of independence. Next slide. Even with this level of risk, we see a clear gap between awareness and action. NHCOA conducted a survey of over 500 Latino adults, and while 89% had heard of osteoporosis, only 34% had been screened for it. We also found that many people believe that calcium alone is enough to prevent osteoporosis. But bone health really does depend on a multiple level of factors. And fewer than half reported exercising regularly, even though movement, which may sound counterintuitive, is one of the most effective ways to maintain bone strength. So what this tells us is that awareness is there, but people don't always have the information and support to take action. And that gap matters because prevention is most effective before a fracture occurs. And this is where caregivers can step in. Next slide. We know that even when people are aware, there are real barriers to care. Many individuals report limited communication with providers. Bone health simply isn't being discussed during routine visits. There is also cost and insurance challenges that make screening and treatment difficult to access. Cultural beliefs can play a role as well, with bone health or bone loss sometimes being seen as a normal part of aging rather than something that's preventable. And language barriers, along with limited awareness of resources, make it harder to access clear and actionable information. So people are often navigating a system that wasn't necessarily designed with them in mind, and that complexity can delay and or prevent care. Next slide. Caregivers are central to osteoporosis management. They can support medication adherence, encourage activity, and help with recovery after a fracture. But there's an important balance. Out of care and concern, it's natural to want to protect our loved ones. Sometimes we do this by limiting movement that can actually slow recovery and reduce strength over time. And just as important, caregivers themselves are at risk. The physical and emotional demands of caregiving, which we've heard about today, can lead to burnout and negatively impact their own health. Much of this work is invisible. Coordinating care, managing medications, and making daily decisions, often without formal support. So while caregivers are essential, they also are carrying a significant burden. Next slide. So let's shift to practical strategies for osteoporosis, and we'll start with fall prevention. Falls are one of the biggest risks for individuals with osteoporosis or low bone density. One important step is accessing expert advice early. Many people don't realize that they can request an occupational therapist to assess their home before a fall happens. An occupational therapist can identify risks that may not be obvious and recommend practical changes like improving lighting, rearranging furniture, and adding supports. Removing hazards is also key. Things like loose rugs, clutter, or uneven walkways increase fall risks. We also want to help individuals avoid high-risk activities like heavy lifting or climbing. But remember, we want to encourage safe independence. Movement supports strength, balance, and confidence. The goal here is not to restrict activity, but to make it safer. Next slide. In addition to safety, daily habits play a major role in bone health. Calcium is essential, but it's only part of the picture. Vitamin D helps the body absorb calcium, and it is needed for calcium to be effective. Many older adults may not be getting enough vitamin D, especially if they're spending a lot of time indoors. Protein is also important, particularly for supporting muscle and supporting recovery. And movement, as I've said before, is just as critical. Weight-bearing activities like walking or light strength exercises help maintain bone density and balance. Even small, consistent movement can make a difference. Remember, inactivity increases risk. Caregivers also support medication adherence through reminders, routines, or simple tools like pill organizers. These everyday supports can have meaningful impact on long-term outcomes. Next slide. And then caregiving doesn't stop at home, it extends into the healthcare system. Caregivers often attend appointments, help process information, and make sure that important details aren't missed. Medical visits can be overwhelming, and having someone there to listen and follow up can make a big difference. Caregivers can ask questions such as, what screenings are needed? Is this medication the right fit for my loved one? And what should we be watching for? Caregivers also help track medications and help coordinate across care providers. They also advocate for screenings like DEXA scans, which are critical but not always offered. And sometimes it's as simple as asking the question. So caregivers are often care coordinators, connecting all pieces so that nothing falls through the cracks. Next slide. And finally, like my colleagues, I also want to talk about something that gets overlooked: caregiver self-care. Caregiving is demanding physically, emotionally, and mentally. And many people don't identify themselves as caregivers. They just see themselves as helping a loved one. But that can make it harder to recognize when you yourself may need support. Over time, caregiving can lead to stress and burnout. So taking care of yourself is not optional, it's necessary. Ask for help early. Remember that you don't have to navigate this alone. Protect your time, protect your energy, and protect your health, because your well-being directly impacts the care you're able to provide to your loved one. Taking care of yourself is not selfish. It's what allows you to continue caring for your loved one. Next slide. I am going to give you a moment to scan the QR code. It will take you to a curated list of caregiver resources specific for osteoporosis. On the right side is a preview of what that page looks like. You'll find directed links to trusted organizations. These resources can help answer questions, provide guidance, and connect you to additional support. Please feel free to bookmark this and come back to it later. Next slide. And thank you for being here. Remember that osteoporosis is preventable, manageable, and something we can address, but only if people have the right information and support. And caregivers are at the center of that. By supporting caregivers, we're not just improving care, we're improving outcomes for the entire family and our community. Thank you.
Thank you so much, Christina, for sharing this important information. And just doing echo of what you just mentioned, taking care of ourselves is not optional, it's necessary. So thank you, Christina, again for sharing the resources, the osteoporosis resources. So our final item on today's agenda will take the form a little bit different, like a fireside discussion. So, addressing the digital divide among older adults and caregivers is key to enduring access to essential services and also staying connected. So, as part of our work, we have our signature program that is NHCOA's Ageless Technology Program that helps close this gap. We have trained like over 2,500 older adults and caregivers in technology skills and also empowering them with the tools and confidence that they need when navigating an increasingly digital world. So, in today's rapidly evolving world, it is more important than ever to ensure equitable access to technology for older adults and their caregivers. So we are thrilled to have Ms. Rosa Mendoza. She's the founder, president, and CEO of Alvanza. She will be answering our questions about the digital divide's impact on older adults and the caregivers who support them. So welcome, Ms. Mendoza. Rosa, we cannot hear you. Let me. Hmm. Rosa, can you hear us? Well, I don't know, Rosa. Well,
Christine, this is Dr. Cruz. We're trying to get a hold of Rosa.
yes,
So
thank
you
you.
maybe take
Oh,
a
I
seconds.
think she's here. Hi, Rosa.
Hi, all. My apologies. I had some issues with technology. Love it. In a
No
conversation about
worries.
technology, I gotta have issues with technology.
Thank you for being here. We can see you and we can hear you.
Perfect. Perfect.
Okay, Rosa. So let's go with our first question, and it is: what are the main reasons that older adults and the caregivers supporting them struggle with digital technology, and how does this affect their ability to manage health and staying connected to care? If you can talk a little bit about that.
Absolutely. And again, thank you so much for including me in this important conversation. And my apologies again that I had some technical issues. My name is Rosa Mendoza. I'm the founder, president, and CEO of Alvanza. Alvanza is a nonpartisan that focuses on innovation policy issues. And we also work in the intersection of healthcare and innovation, which is why I'm glad to be speaking about this important subject. You know, Christine, we as a country have not closed the digital divide, which means that there's still people that are not taking advantage of the digital resources because they're not able to navigate the online world successfully and safely. And when it comes to, some of the folks that are not doing that, the older community is obviously one of the main communities that is not on board yet for many reasons. In this case, given the question you ask, older adults and caregivers often face barriers like limited experience with technology, obviously, because they're not digital natives, right? So their experience is limited. There's physical challenges like vision issues. And then there's apps that are very complicated, right? Some devices designed in a very complicated way. So it's difficult for seniors to be able to use these technologies because, again, they're not digital natives. Also, many also worry about privacy issues and making mistakes, and I don't blame them. When it comes to going online and navigating this world successfully, seniors are often not successful, and in fact they're often the targets of scams because of the fact that they may enter their information in a website that is not trusted and their information gets stolen. So because of that, they're very cautious and careful and scared many times to go online and use the resources available. And when it comes to the caregivers, I mean, as we know, they're very busy already, and they may not have the time to learn these new systems. So as a result, people may miss telehealth appointments, avoid using patient portals, and struggle to manage medications and health information because of that. This obviously leads to delays in care, negative health outcomes, and increased social isolation, unfortunately, for seniors.
Excellent. And I want to echo also of what you just mentioned, Rosa, in regards that also we have seen in the field that some of the older adults don't have the technology. Like, for example, they have old phones, like flip
Correct.
phones, and they rely a lot on the caregivers or in their family members to help them access the digital world, right? So
Correct.
my next question will be, how can healthcare systems design digital tools like telehealth or remote monitoring that are easy for both the older adults and the caregivers to use, especially when technology skills, the time, or physical abilities are limited?
Yeah. These tools should be designed in a simple way, right? And they should be intuitive with large buttons, especially for seniors, because obviously, there's vision challenges, right? Sometimes they should have clear instructions and as few steps as possible. That's even important for all of us, not just for seniors, right? Sometimes, you go to the doctor and they're like, oh, create a profile on our portal. And it's extremely complicated. There's too many steps. It's not system is not user friendly, so it's been very complicated for me to do a profile in a lot of these portals, and they require that. They're like, you have to send whatever information through here, or if you want to check something, you got to do this profile, and sometimes it can be really complicated. So it's important that these systems are user friendly. Accessibility features like voice commands are obviously also helpful, right? Especially for senior. Adjustable text are essential, and it's important that these digital tools be tested with older adults, right? Not with younger folks, digital natives, because the experience is very different. So they have to test these digital tools with older adults to ensure that we're actually taking their feedback and making the changes that can help seniors navigate the online world better and safely, and again, in an effective way. It's important to provide fast and easy to reach support when needed. The goal should be to reduce the effort so that the focus can be on their health and not on the technology, right? There's already, especially older adults, right? They have so many doctor's appointments. So they should be focused on that and not on how to navigate the technology that they need to use.
Yes, and also some of the seniors or don't have that motor skills. So when they do, as you mentioned, the patient's portal in the tablet, they find it difficult
Of course,
to use it. Sometimes they don't even know how to read or write. So that's something that it's complicated or challenging, but let's say it like that.
absolutely. Yes, it's a
So our
huge
next,
challenge for seniors.
yes, huge challenge. We have seen it a lot here
Mhm.
at our office. So caregivers often help bridge the technology gap. So what does that role look like in practice, and how can healthcare organizations better support caregivers without adding to their workload or stress?
I think in practice, I believe that a lot of caregivers set up devices, manage, logins, attend telehealth visits, track medications, and communicate with healthcare, providers. It's my understanding that they also troubleshoot, when technology doesn't work, so their role that they play is very important, and depending on the situation, obviously they get more or less involved. And when it comes to healthcare organizations, they can support caregivers by giving them proper access, permissions, offering, caregiver specific training, again, simplifying the platforms, right? And not making them really complicated, making them user friendly so that anybody can go in and be able to access the information, providing flexible communication options, etc. Again, the focus should be on making the role easier, not adding more responsibility, because they already have plenty of responsibility.
I agree. And as you just mentioned, we also think that healthcare organizations or companies need to prioritize, like when they make technology, just as you mentioned, to be simple, accessible, and user friendly, and offering like clear guidance, even training, bilingual trainings,
Absolutely.
and resources that can reduce that burden on caregivers rather than increasing it. Because as you
Right.
mentioned, they have a lot too on their plate, in addition to caring for a loved one.
Absolutely. And again, as I mentioned, and you agree, it's important that they test these tools, right? These digital tools by getting feedback, from seniors, right? Because sometimes these, the companies that create these tools, they test it among themselves, like, oh, we created this great platform or this great app or this great portal. But it's like, well, it's great and easy for you because you're a techie. You know technology, you understand this, your background is in technology, you're a tech person, the rest of us are not. So sure, it may be easy for you, and to you it's, very easy to navigate because you understand that, but we don't, especially seniors. Again, they're not digital natives. So again, it's important that these tools be designed and tested with real adults, right? Again, not themselves or digital natives. So the proper feedback be provided, and the tools can be designed the right way.
With a target audience that would be seniors.
Correct. Correct.
Thank you, Rosa. So our next question is, even when devices and internet access are available, they're not always used. What strategies have you seen that helped both the older adults and the caregivers feel confident and also consistent in using digital health tools?
Confidence builds through hands-on training, simple step-by-step guidance, and ongoing support from a real person. I think it's really important that, seniors be given the option and older adults to use technology, but they are so used to picking up the phone and talking to a person. So it's important to also ensure that they have that option, right? Um, Introducing one feature at a time is important too, because this helps to avoid confusion and then feeling overwhelmed. Like, oh, seniors are, sure, quick to say, look, this is not for me. I can't use technology, right? Because again, they're not digital natives, so they already have that in a way, negativity, right, towards new things and technology, especially. So it's important to help them not feel overwhelmed and, again, introduce one feature at a time, do, the proper training. Trust is also key, obviously. Clear explanations about privacy and safety really matter because, again, as I mentioned, because of some of the issues that they faced and because of the fact that they're, targets of scams, it's important to explain to them their privacy rights and things that they can do to protect themselves when they are online. Using familiar tools like text messaging and providing reminders and encouragement from healthcare providers can improve consistent use as well.
I agree completely. So, how can healthcare providers, technology companies, and community organizations work together to better support caregivers while also reaching more older adults in an equitable way?
I believe that collaboration works best when healthcare providers, for example, identify needs, when technology companies design user-friendly solutions, and when community organizations provide training and access in trusted local settings, right? That's extremely important because, again, it's difficult to just trust any organization when you know nothing about it, right? So it's important that they do it in their community and trusted local settings so that they feel more comfortable even getting information about these issues. Um, the effort should include affordable devices and internet, multilingual resources, and outreach to underserved populations. Meeting people where they are, obviously, is very important, both physically and digitally, right? It's critical that we understand that. And I think all of that combined can really help with this.
Yes, and I want to highlight there that we also have learned that repetition is key, right? When working with older adults. For example, in our ageless technology program, participants may successfully complete the tasks that are shown for them and to practice, such as, for example, conducting like an online search in an internet browser and during a session, but they may forget steps later. So
Absolutely.
repeating again these activities, repetition is key and essential to help them like reinforcing learning and also supporting that long-term retention.
Absolutely. And it's already difficult. I mean, I don't know about you, but it's very difficult to just stay, up to date with everything that's going on in innovation and technology. It's difficult for
Yes.
us, including, digital natives. I cannot imagine how difficult it is for seniors.
For
Again,
the older adults.
right, exactly. So yes, it is important to educate him about this, right, and try to teach him how to how to use these tools and these digital tools and how to navigate the online world safely. But it's certainly going to take more than one time. Again, I don't consider myself a tech savvy person. So yes, there's times when I'm like, in fact, I'm clearly had technology issues before we started, and sometimes it's I sometimes I join certain platforms and I'm like, how do I mute myself? How do I unmute myself? It takes me a couple seconds to even figure that out sometimes, depending on the platform that you're using. And sure, there's platforms that I use, and in fact, there's one particular platform that I use that every year I struggle with. And I have to go back because I use it on a yearly basis for something related to my nonprofit. And every year I have to go back and look at my notes to remember exactly what to do, when I'm logged in. So I have to go back and look, and I'm like, oh, okay, I need to go to this area and click here and do this for me to be able to, finish the process that I need to finish. And it's something that I do on a yearly basis. And I
And
still have issues with it. So yes, absolutely. They need to have the proper training and the proper reminders and
yeah.
again, ensure that they fully understand it. One time is not going to do it.
Mm-mm. And at the end, we always learn new things. We
Mhm.
never stop learning.
Absolutely.
So, our last question for this fireside discussion with Rosa is what emerging technologies like artificial intelligence, or also known as AI, voice assistants, or in home monitoring, can make life easier for both older adults and caregivers? And how do we ensure that these tools reduce rather than widen existing gaps?
I think helpful technologies include voice assistants, as you mentioned, like Amazon Echo and voice assistants of the sort, AI-powered reminders, remote monitoring devices, and smart home systems that can detect changes in routine or potential safety issues. To again prevent widening the gaps. These tools must be affordable, obviously, easy to use. Again, I cannot emphasize that enough because again, even I have issues with certain technologies that are not easy to use, certain platforms that are not easy to use. And design, again, as I mentioned already, with older adults in mind. That is extremely important because, again, what can be something easy for us or for the designers, they may not be easy for older adults. Strong privacy protections are important. Human support, as I mentioned, obviously, because imagine an older adult navigating an online platform and they don't understand a certain step. It's important that they are able to pick up the phone and call someone, and that person can walk them through the steps in a way that they can understand and go back and finish the process. And testing in a wide range of communities is also important to ensure that these technologies truly improve access and care for all Americans.
Perfect. And also, we need to take into consideration, as we have mentioned previously, many older adults may have limited literacy skills. So, just as you mentioned, the Amazon Echo, so that'll be kind of like a speech-based technology, right? That can be an effective tool for individuals, even for
Absolutely.
older adults that cannot read or write, but when they use Siri, or that's found in the iPhone, or Alexa in Amazon, right? Or similar voice assistant, that can be helpful when communicating with others. And again, I think we believe that being attentive to those nuances in the field helps ensure that support is inclusive, as you mentioned earlier, and responsive to the audience needs, particularly for the older adults and their caregivers.
Absolutely. Absolutely. It's extremely important that we close the digital divide, and we cannot leave the elderly community behind
Behind.
when we're doing that. It's a very important community. We got to make sure that, again, they have the tools that they need to be able to, access the resource available online. And we got to make sure they have the training that they need for them to be able to use that access. Because we can, I talk about that often. I'm like, yes, we can give all Americans access to the internet. We can figure out how to, provide infrastructure in every corner of the country, and we can ensure everyone has access. But if they don't have the tools to use it, it doesn't matter if they have the access. They need to have the tools for them to be able to navigate this world successfully. Otherwise, it's not going to happen. And it's just not seniors. Sometimes when we think about this, right, we think, oh, it's just seniors, the very elderly population. No, it's people that are on the younger side, and they still don't know how to navigate the online world. Like when it comes to the Latino community, and I'll stop there because I know you got to wrap this up. But when it comes to the Latino community, there's a lot of adults that are not necessarily elderly, but they don't know how to use, the online world successfully. So they're still
Exactly.
not taking advantage of these benefits. They're still not doing telehealth visits when they can and should. Sometimes they live far away. There's a big Latino community in rural America, and they have to drive 2-3 hours to see a doctor for a routine visit that could easily be done online. But because they don't have, the tools to be able to do this, or the skills, excuse me, to be able to do this, then they, have to waste 2-3 hours of their time, take, off work to be able to do this. And that shouldn't be the case. We got to make sure that, again, everyone has access and the skills they need to be able to take advantage of online resources. Innovation is
Equitable access.
right.
I
Innovation
agree.
now is moving fast, and we got to, catch up with it to ensure that we're not left behind.
Thank you so much, Rosa, for sharing your expertise with us today. So, as we close the panel session, we thank each of our speakers once again for making today's webinar such a well informed discussion. And now we will begin with a very short question and answer session. So, I encourage all the panelists, if they can uh, join us and unmute yourself or with your camera on. So I have a question and from the audience, and it's as follow. Can you? This is open to anyone. So if the question is, can you discuss the specific ongoing efforts to advocate with the lawmakers? So that can be like related to caregiving efforts or your current work. So Pedro, if you're gonna, I think you.
Yeah, I did raise my hand if you want to start. Well, at the National Hispanic Council on Aging, this is the core for us. So we provide a report every year to legislators that we call the status of Hispanic older adults. And this is collective um, data that we have throughout the year. And with that, we do a Capitol Hill briefing where we share this information with legislators and not just that year. Throughout the year, we do legislative breakfast, briefings at the Hill, And the most important part now, as I was mentioning when I was speaking, is that we do have this storytelling program where we are raising the voices for older adults. We are empowering them, and we're bringing them to be their own voices, their own advocates. So when we have those briefings, we always include the people that are most vulnerable to have a voice there and to represent themselves. So this is a way we do, and also of course partnerships with the DEC, for example, or other coalitions. So those events happens, I mean, in various months and years throughout the year, and that's how we do have the ongoing uh, advocacy.
Thank you, Pedro, for the answer to the question. And I know we're short of time, but I have like two more, and this is open to anyone. And will be, what are some practical ways or tips that caregivers can prioritize their own well-being while continuing to care for others? I know we mentioned uh, s- uh, the keys or yeah, practical ways. But if you want to highlight others that caregivers can take into consideration.
Sorry, Christine, can you repeat that question? I just got back
Yes.
on.
What are some practical ways or tips for caregivers for them to prioritize their own well-being while continuing caring for others or a loved one? Mhm.
I'll go. I just think it's about putting yourself first. Your health and well-being is very important when it comes to the health and well-being of the one you're providing care for. I think in terms of practical self, is just getting a sense of how you're feeling. Whether it be burnt out, whether it be emotionally or mentally drained, and take it from there and explain that to your care recipient. I think people would be surprised uh, by how receptive their care recipient is when you open those lines of communications with them in terms of how you need to care for yourselves. I think a lot of times caregivers forget how much care recipients care about them and their well-being. And so when you open those line of communications and you talk about, oh, I may just need some time for myself and whatnot, they'll be very receptive in that regard. And so I just think open lines of communications, be honest with yourself, and take a deep self-reflection.
Yes, and always ask for help too. It's never too late. It's not bad to ask for help too. So, yes, Rosa, if you want to
Yes,
highlight something.
yes, I do actually, because technology has transformed the way we live, the way we work, the way we do everything. So I think they should rely on technological tools too, to help them make their job a little bit easier, even things that can help them stay organized. Because again, some of these caregivers, and by the way, I used to be a caregiver many, 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 many years ago. I worked at a retirement home, so people stay very, very busy doing their job. But again, trying to use technology, even if you're not a caregiver, obviously we're discussing this issue now, but I think in general, we can and should rely on technology to do a lot of what we do. It makes it easier. It's, again, even using tools that can help us stay organized or reminders so that we don't forget certain things, certain appointments, right? So technology can facilitate a lot of what we do. And I highly encourage that because again, there's an app for everything, for example. So even downloading certain apps that can help you, again, do your job more effectively and better with less stress. I think that would be helpful for them.
Perfect. Thank you so much, Rosa. Anyone else would like to highlight something? Or if not, we can continue. We need to close because time constraints. But once again, as we finish the question and answer session, we would like to thank all of our attendees and experts for joining today's virtual event. So before closing this event, we have a special invitation for everyone, and we want to invite you to join a growing movement of individuals um, dedicated to improving the lives of older adults, their families, and caregivers. through our individual membership program that you will see in this slide. So, as a member, you will gain access to exclusive resources, educational workshops, advocacy tools, bilingual information on health and aging, all while directly supporting NACOA's mission to uplift and empower our community. To learn more on how to become a member today, we encourage you to scan the QR code that it's on your screen. So before ending, also we want to let you know that today's webinar recording will be available on our YouTube channel. And again, we encourage all of you to follow us on our NACOA social media channels. You can find us on Facebook, Instagram, and X, or formerly known as Twitter, and Instagram as using at NHCOA for more information and news of upcoming events. So thank you, and until the next one. Gracias. Bye-bye.
Thank you, everyone.
Thank you. Bye bye.
Thank you. Bye.